good afternoon. Welcome again to BuyBrevard.com TV. I'm your host, Michael Gall, and with us today is Dr. Timothy Bortz from Brevard Chiropractic and Injury Clinic. It's great to have you here with us
Thank
today.
you for having me here. Thank you.
Good to have you. We're in a time, or in a world, if you will, where self-treatment for all kinds of things is common practice. Everybody's trying to save a buck here and
Sure.
there, and obviously there's a lot of danger in that. But let's begin talking a little bit about how long your practice has been around, and then I want to really share with our listeners today about some of the unique things that you have to offer.
Sure. We actually took over a practice that was established. It had been in the area for about 10 years. We've taken it over about 2 years ago. It's Brevard Chiropractic and Injury Center. Our main focus is obviously chiropractic, but we do help a lot of accident victims as well. That's the injury side of it. With the treatments that we do, there's obviously chiropractic, but we do more than that for the patients. We do passive therapies, that's stuff done to the patients. And we also focus a lot on physical therapy. When a patient is injured, physical therapy helps to rehab that tissue back to what it was before the accident.
Sure.
Okay.
Well, and that part of it, certainly with BuyBrevard.com TV, where we're looking for local businesses to be featured, as an employer, it's very important to get employees back to work as quickly as possible, but that's also the motivation for the employee. And using chiropractic treatments can be very effective in that, particularly in the way of injuries. What are some of the more common injuries that you deal with at your location?
Well, obviously lower back pain. Normally people go see chiropractors when they have lower back pain. And pain can come on for several different reasons. There's ligaments and muscles that hold the joints in the correct position. When those joints slip out of position, it stretches that soft tissue, causing pain in the area. Simply adjusting those joints, putting them back in the correct position can alleviate most of that pain. Then if you have any type of further damage in that tissue, and I'm talking about the areas in between the bones. Let me show you in the model here. You have bones in your back, and in between these bones we have discs. These discs are kind of like cartilage type material. Well, there's two different areas in the disc. There's a center nucleus and then an annular fiber that holds in that center nucleus. Now think of the disc like a jelly donut. If you squish a jelly donut, jelly comes out the side. That's called a herniation. Now, when you have herniations either in your neck or in your back, you can have pressure on the nerves. If you have pressure on a nerve, you will feel pain, numbness, or tingling to wherever that nerve goes to. So if you have someone that has pain down their leg, that's most likely coming from pressure on the nerve coming from the lower back.
Sure.
Now we have treatments chiropractically for the disc. We can adjust those joints, and we also have a manual traction that we can do to open up these joints. What that does is because these discs are connected to the bones above and below, if you pull these joints apart, that creates a negative pressure in that disc, pulling that herniation back in. Now we also have a decompression table at my clinic. A decompression table is a table that you kind of get wear a big belt across the belly and one across the top, and it really pulls those joints apart. Okay, it does what I can do manually just to a greater level, and it really helps to pull those in. Again, using the analogy of a jelly donut, if you squish a jelly donut, jelly comes out the side.
Sure.
But if you can grab the tops and bottoms of that jelly donut and pull it out, and that jelly gets sucked back in, that's what decompression can do.
Fantastic. In terms of maybe like sports-related injuries, probably what is one of the more common injuries that you see there at the center?
It's a lot of lower back problems. There's a lot of golfers, obviously in Florida, and a lot of lower back complaints. Pulled muscles, sprain strain type injuries. Chiropractic, adjusting those joints back in the correct position. Passive therapies, either EMS, electrical muscle stimulation, ultrasound, hydrotherapy table to get that tissue healed back to what it was before it was damaged.
Now, as people would come to the center, what's your standard way that you begin working or interviewing a potential patient in terms of how you analyze what they may need?
Well, the first visit is free consultation. Any patient that comes in can sit down with me and I can talk to them about the problems, talk to them about what we offer. After that, there's always an exam, okay? Obviously, I have to do an exam on a person to see what's going on with them. And I always take x-rays, see what's going on underneath the skin. See if there's any osteophytes, degeneration, bone spurs, anything that I should be concerned about before I start moving those joints around.
Good. Well, I know through the years I made, and I'm dating myself here, but going back 20 years, chiropractic medicine didn't always have the best name.
Sure.
But it obviously is a generally accepted form of treatment, not necessarily even an alternative, but often sought after, recommended. and offers a great deal of relief to people.
It has gotten a lot more acceptance in mainstream medical community than what it has been.
Yeah.
I myself get referrals from other clinics, other medical doctors for lower back problems that they've been having with their patients, send them to me.
Excellent. If there was one thing that you would want everyone to know that would come to the center that they could always expect, either in terms of the quality of treatment or the types of things that you would do there, what would that one singular thing be?
We try to help the patient the best that we can when they're in the clinic there, and that's whether that's the adjustment or the therapies or the physical therapy or decompression. We'll always try to give them the best treatment that they can get in that time frame while they're there.
Excellent. Well, it's been great to have you with us today, Dr.
Thank you.
Bortz.
Nice having you.
And thank you again for joining us at BuyBrevard.com TV. We focus and feature the best local businesses in Brevard County because we really believe that if you buy Brevard, you build Brevard. Thanks for joining us. I'm your host, Mike Gall, and we'll see you again next time.